Hello friends, my name is Dr. Tejinder Singh. I am a senior medical oncologist practicing in Apollo Hospital, Navi, Mumbai. Basically, in the last few decades, we are seeing that the cancer per se in India is increasing. If you see in India, there are around 11 to 12 lakh new cases detected every year. The problem is not with number of cases which are getting detected. The problem is that out of this 12 lakhs per year, approximately two-thirds of the patient they are coming in advanced stage. And cancer is one thing where there are some cancer which are preventable, but there are some cancer which are not preventable. So most important thing is that if you are able to, if a person is aware of the side and signs and symptoms of cancer, they can come to the hospital early. And so early detection is a very key to the cure of the cancer. So every cancer basically can have preventable causes or non-preventable causes. In India, around 30 to 50% cancer happens because of an important thing called tobacco, either by able to eating it or through smoking. And these two cancer, head and neck cancers, all the head and neck cancer and lung cancer, and there are around 14 cancers which are related to tobacco, including stomach cancer, food pipe cancer, and bladder cancer also. So if the preventable cancers, by removing the tobacco from our diet and our daily habit, if we can remove the tobacco, we will be able to remove nearly 50% of the cancer. The second thing is that there are some cancer where you cannot prevent the cancer, like breast cancer, where you cannot do any kind of prevention. The most important crux in that thing is early detection. So that's the reason why screening modalities are available for breast cancer. That is, for mammography is there. And if a lady is able to do a mammography annually after the age of 45 to 50 years, the probability of picking up early cancer is there. And if you are able to detect the cancer early, the success rate is more than 95 to 100%. We need to be remaining aware that we need to be cautious that there are certain signs and symptoms of cancer, like change in the bowel habit, altered bowel habit. There's a change in the voice of speaking, the thing which happens with the malignancy patient, bleeding from the motion area, and if a patient has got an ulcer which is not healing in the mouth, these need to be properly investigated and brought to the notice of the doctor, and patient should come to the things. Second is the awareness about screening. Now every hospital, every place has got mammography machines. There are now tests for doing pap smear for cervical cancer. And if you are able to detect it early, the cancer can be cured to a great extent. So my appeal to everyone is that we need to be remaining aware that cancer is something which is increasing. If we are able to diagnose it early, the chances of cure it is very high. Thank you. Thank you everyone.